Hello. The Child Welfare Capacity Building Collaborative's Center for States is pleased to welcome you to this year's Child Welfare Virtual Expo. My name is Elizabeth Eaton, and I'm going to go over just a few housekeeping items before we get started today. If you are reading the closed captioning but not hearing anything, try turning up the external speakers on your computer or device. As you logged in and entered the virtual expo today, you may have noticed that there are several areas for you to visit and explore, accessible through the top navigation or from the main home or conference lobby. Because you are seeing me now, we know that you made it to the theater. This is where you can find sessions that match your interests. Keep in mind that we are accessible on your tablet and cell phone, so feel free to take us with you to listen to throughout your day. In your current view, you will notice that there are several windows that you can move around, make larger or smaller, all by clicking on the top right corner of the window. If you have not done so already, we encourage you to set up your profile by clicking on the My Profile tab. This will only take a few minutes. Your profile is where you will access your virtual business card that you can share with fellow participants as you network and make connections. It's also the spot where you can save and store resources in your virtual briefcase to download at the end of the event. You can plan your day by reviewing the agenda and adding sessions to your schedule under the My Agenda dropdown. And between sessions, be sure to visit the exhibit hall, gallery, and networking lounge to gather resources and connect with others. Just a reminder that we are also on social media, so please use the hashtag CWVE in your posts as you share your experiences today. We also invite you to earn badges by completing activities throughout the day and engage in some friendly competition with your colleagues. You'll be able to view the top scores on the leaderboard in the badge area, accessible through the top navigation. And of course, if you need technical support or assistance throughout the day, you can access staff in the help desk anytime by clicking on Help at the top of your screen. Before we get started today, I wanted to mention that we will present a feedback survey at the end of each session and at the conclusion of today's event, as your feedback is incredibly important to us. And you can earn continuing education units for several of our sessions today. Please visit the Resource Center and click on the tab CEU Information to learn more. Now, please join me in welcoming Maggie Bishop, Executive Director of the Capacity Building Center for States.
Thank you, Elizabeth, and good morning. Welcome everyone to our 2019 Child Welfare Virtual Expo, and thank you for being a part of this important event. This is such an exciting opportunity to connect with colleagues across the country on our continuous journey to improve outcomes for children, youth, and families. Before we begin, I'd like to thank our collaborative partners, the Center for Tribes and the Center for Courts, for their contribution to today's expo. I would also like to thank the Children's Bureau staff who generously contributed their time and effort to help plan this event. And finally, a big thank you to our expo planning team, composed of our talented speakers, subject matter experts, family and young adult consultants, and administrative staff. This partnership in planning for this day has been extraordinary, so a special thank you to all of you. Now, I'm excited to help to introduce this year's theme, Effectiveness in Child Welfare, Our Role in Improving the Lives of Children and Families. This year, we chose to focus on using data and evidence to improve practice, because this is even more important today than ever. If we want to work on improving child welfare outcomes, support evidence-based policymaking, continue to build evidence of effectiveness in child welfare, and meaningfully engage staff, children, youth, and families at all levels within agencies, data can be an extremely powerful tool and can be invaluable for all of us as we develop or assess policy. As we look to determine effectiveness of practice, data helps to tell the story. Understanding how each of us can contribute to evidence building and using data in child welfare is critical, so we can have an impact and truly make a difference for the children and youth and families we serve. And now, I'd like to introduce the moderator of our distinguished panel, who is going to kick off our discussion of data and evidence-based practice in child welfare, Nicole Barnes. Nicole is the Senior Consistency Services Manager with the Center for States. She works to build knowledge, skills, and peer-to-peer connections with partners in state and territorial public child welfare agencies. Nicole has more than 20 years' experience in various child welfare leadership roles. She specializes in understanding public health as it relates to children and families, at-risk, trauma-exposed, and military populations, and has extensive experience working on community education. And now I will turn things over to Nicole.
Thank you, Maggie, and thanks to all of you for joining this year's Child Welfare Virtual Expo. As a reminder, if you need assistance today, the help desk is available. My name is Nicole Barnes, and I'm with the Capacity Building Center for States. What does it mean to be effective in child welfare? This is a pretty broad question, and so let's dig in a little bit further into this to set the context for what we want to achieve today. So we know that the child welfare system is comprised of a lot of different individual systems. For example, our child welfare agencies, our court partners, our private providers, our tribal child welfare professionals and tribal teams. Each of these individual systems has a specific function within child welfare that, when operating well, provides the overarching goals of the broader child welfare system to promote the health, safety, and well-being of children and families in their own communities so that they can thrive. Each system is inherently responsible for promoting their own effectiveness, as is each individual within the system. They each have a role to play in being effective in their everyday work, in effective practice with families, effective data entry, and effective communications. These are all pieces of the overarching effort to be better and to be curious about how our actions impact it. Effectiveness at its heart depends on knowledge or evidence that is properly generated, produced, and then used to support problem solving and good decisions. In this session today, we want to provide some examples of how each of us approaches our work so that we can promote effective in our part of the child welfare system. Child welfare systems have many opportunities to understand how their system performs. From our frontline child welfare workforce professionals, they take on the task every day of effectively engaging families and entering data about those interactions, including the interventions that they use and the services provided. To our court professionals and partners who see children, youth, and families daily in their courtrooms and must use data to make decisions about practice to ensure that children are safe and on a path to permanency. And to our tribal child welfare professionals who might use data to determine best strategies to recruit and engage resource families who can support the needs of Native children and families. And child welfare agency administrators and program managers who rely on data and engagement of youth and families and in the system to comprehensively understand how effectively they are performing on child welfare service reviews, program improvement plans, or determining the best strategies to include in those. We want to hear a little bit more from each of our presenters about being effective, about what connects us to what we do in our everyday work to the overarching goals of the child welfare system, to ongoing CQI efforts, and the contributions to child welfare research and evaluation efforts at all levels. So how are we collecting, sharing, consuming, and using data to be part of the decision-making process at all levels in child welfare?
Well, I can start with an attempt to answer from the federal perspective, because essentially that's what I oversee and what I am trying to be better at. We collect data as a matter of course through the Child and Family Services Review and through these national data systems that states have to contribute to. What I'd like to do is to be even better at understanding what we want to know and matching what we want to know to the assets we have to consult and to generating an answer that responds to our questions. At the federal level, we want to know a lot of things. We want to know whether states have systems that execute their responsibilities effectively so that the outcomes for children and families are continually improving. What I want to do in my job through this CFSR process and through generating information from national data sets is to ask the questions that help me understand from the federal perspective how well are states doing, and then push that information back out to the states so that they can make decisions about what they want to keep on doing and what they want to be doing differently. So for example, we might want to know whether the process of following up on an investigation is effective. That's information we might get from the Child and Family Services case review, and we might understand its effectiveness by connecting that with an outcome around safety and maltreatment of children. And together with that information, what I'd like to do is have that trigger more questions. And the questions that it triggers and the answers those questions provide get sort of fed back into this process of using information that the federal government collects to structure what activities states and their partners can do to change a process so that an outcome might look different. So I'm going to stop there and tell you that's one of the key ways that I rely on data.
And for us in Maryland, one of the things that we have been doing in connection to our state-led CFSR is we've been having kind of data dive meetings with our teams locally to be able to go over what their data, what the numbers are saying before we actually come in to do the case reviews. And then I think it's the debriefs that we're having after we've done the interviews related to the specific reviews. So when we've talked with parents, when we've talked with youth, caregivers, our other partners, being able to talk about kind of what would we maybe do differently and in a better way. And I think by building in opportunities to talk about data in a variety of forms and in a variety of forums, it becomes a little bit more comfortable. And then we can start talking about, like, so this might be a really great practice, but if it's not actually having our intended outcome, maybe we shouldn't do it anymore, as we're talking about time, energy, financial resources, and having to make those decisions. At the same time, not devaluing the fact that the practice or the intervention might have been really great. It just didn't work in the way that we needed it to. And I think being able to have those conversations and tying it to then decisions is a really important way that we've been trying to integrate how we build an effectiveness in our use of data in Maryland.
Across the country, the legal and judicial systems have come a really long way in their ability to collect and use data to inform systems change in programming, much in the way that you were talking about that you're doing in Maryland. However, for the legal and judicial systems, there's not yet a solid evidence base of legal and judicial practices upon which to draw on in making those system improvement efforts. We have some evidence on best practices and what works, and we kind of know anecdotally what works. But we need to continue harnessing the work and collecting data on the things that we believe work well, and continue to report on those efforts and engage in strong evaluations of programming in order to inform the field and not just our own practices that we think are working well. I know sometimes it's hard to think from the being a lawyer or being a judge perspective that you're going to be able to do this kind of robust CQI type of work. So I would encourage those of you who are watching this to tune in to our Becoming a Workforce of Everyday Scientists, because we're going to be talking specifically to the lawyers and the judges about how you can do that, and we can start building some of that evidence base together.
I think to echo what both of you have just said, I think when you are having those interviews and the time where you're working one-on-one with a family in a CQI effort, having a little bit of training first so that the families know kind of what they're getting into, but can provide more meaningful and effective feedback and qualitative data that help support the programs or program changes that are needed.
Right, and I would just add that all of that is exactly what I think that we're trying actively to promote at the federal level. And for me, one of the easiest way, or one of the things that I like to focus on, is that generating evidence or information for the federal reviews is not the end. It's not the end of the story, it's the beginning of the story. And just each of the things that you all just said sort of amplifies on that. We're trying to be continually curious. You learn something, you ask a question, you get an answer, and then you keep asking more questions. And I think each of you is just sort of modeled exactly how to do that and why it's so important, because you don't get change unless you use the information you gather to do something different.
Awesome. That's great. So we discussed earlier how each individual in the child welfare system has a unique responsibility to really contribute to effectiveness and knowledge base. How can we create an environment in child welfare that encourages sharing data across areas and really promotes a culture of shared accountability?
Well, I'll start. From the legal and judicial perspective, again, I cannot underestimate the value and the power of strong judicial leadership. And again, I said this earlier, but it's important both at the systems level and at the individual case level, that strong judicial leadership. We know that judges are powerful conveners, right? When they ask people to come to the table, they generally come. But judges who also create that space for everyone to have an equal voice at the collaborative table fosters that willingness of everyone to share and to be open. You know, coming to the table with a mindset of this is our data, all of our data, and what I'm presenting is my system's collection of that information is really important, rather than this is my system's data, and being defensive about what people have to say in response to that. And while referencing the collaborative table, I want to refer back to that concept of integration. So when we talk about collaboration, we're talking about really just kind of sharing information. This is what we're doing. This is the data that we have. These are the programs that we're going to be implementing. And we talk about integrating. We talk about this is our data. What does it say for all of us? What kind of programming can we create together? What vision do we have for moving forward? And so I think that's really important. And when the judicial leadership is strong at those tables and creates that space, you do have that ability to be truly integrated with one another and do better for everyone.
I think that's such an important point in regards to the conversation around integrating and it being how it's different. And I think when we talk about data sharing, I think if we're only talking about sharing data in a compliance conversation, then people are going to be afraid of sharing data at all levels of like, what are you going to do? How is this going to come back and be a consequence for me? So if we're able to actually have those integrated conversations and start thinking about the interconnectedness of our systems and how that is playing out in the data, but also in the experience of the people that we serve collectively, I think that really will push us forward in how we're able to utilize data in far more, I think, effective ways of really pushing towards change and progress. If it's more than just a compliance conversation, it's an ability to reflect on how have we been doing, are we getting to where we want to go, or are we doing fantastic, and this is something we want to make sure that we're sharing with everyone, and then being able to hold each other accountable as we're working together around how we're doing and being able to talk about it in kind of really concrete ways.
I think one of the things when you were talking about the interconnectedness, that's a lot where the tribes come in. You know, having those partnerships and also having the transparency to share data, because I know a lot of times as you were talking about the accountability, a lot of people are afraid, what's going to happen if I share this information. But it's, in my perspective is that we should be able to share so that we can be problem solvers. We can work together to be able to figure out, what needs to be done with these children and the families, because we're all in it for them.
Well, and you have to have that level of trust and interconnectedness to even get responses to some of the data sets. I know one thing that we struggle with both families after reunification, with foster families, is will they even respond to a survey or to questions? There's so much fear of a retaliative response of what will happen to my license, or how is this reunification going to go if I score the system negatively. I think that it is so vital to have that authentic, open dialogue so that families are answering and are being authentic with us.
Great. How can we encourage staff at all levels to really engage in and improve our level of effectiveness with children and families?
So I love that question because I think a lot of times we, and I can speak for myself, when you're in a upper management level position, we have the reports that we have to generate. We have to speak to legislators, to stakeholders about the numbers and how we're doing in the aggregate. But I think about when I was a caseworker, and I'm trying my hardest to do the best work possible, and I want to know if what I'm doing is actually working, and if it's not, get some feedback. And so I think, again, creating these spaces where it's a safe place to get feedback, both from who we're working with as colleagues, but also from those that we're serving, and not taking it as judgment and being defensive, but this is an opportunity for me to maybe think about doing something differently. I thought it was really a great idea, but oh, I hear what you're saying. If a parent's giving you feedback or a young person's giving you feedback. And I think that's so important, because that really ultimately is where the change happens. Because at the state level, at the federal level, we can, say all we want about change and program improvement plans, but if the actual actions and the practice aren't changing, and ultimately then the impact and engagement that we have with the communities we're serving, then it's all for naught. And so I think being able to, those safe spaces, to be able to talk about it, reflect on it, and learn from when you make mistakes, and celebrate when you're doing things really well.
And just to continue that, having the power and the ability of that area to make the changes that are needed in a quick and timely fashion. I think that that's one of the big stumbling blocks. You may listen, you may agree, you may want to make that change and then feel unable to. Having that ability changes everything.
Yeah, and I would just add, I think that it's important to understand that making effective use of data there are two things to that activity that I think are equally important. One, it's a skill. And it's a skill that you have to create time and space, and you have to build in your staff. It does not come naturally, nor should it. So if we want sort of line level, frontline staff and the families that we work with to make decisions based on data, we have to teach them how to do that and give them the time. And the second is that it's a behavior. It's not just, I'm going to consult what my textbook says, or I'm going to look at a chart and make a decision. The behavior is, demonstrating curiosity, having the capacity to get the answer to a question, and then understanding that you can do something different or the same thing if the evidence that you've generated allows you to do that. So if we want our staff to do that, we have to give them the opportunity, and we have to build their capacity.
I would just add that it's also courage.
Yeah.
Because if you haven't done it and you're not comfortable with it and you're not sure how it's going to play out, of being able at all levels to have the courage to try and actually do it that way, and be able to say, I don't have the capacity, or I don't understand how to translate this into what it means to a workforce. So getting people at the table who can actually help translate that is really important, and sometimes hard to do.
Agreed.
Yeah, I have to agree. I think I've had a lot of those conversations myself where you're looking at data and you're thinking about the numbers, but I think we really need to translate that into these are children, these are families, and to make sure that we have that focus.
Absolutely. Well, thank you, ladies, so much for joining us today and sharing in your expertise around how we can really build a more effective child welfare system.
Hi everyone, I'm Rebecca Jones-Gaston. I am the Executive Director for the Social Services Administration within the Department of Human Services for the state of Maryland. And I am very delighted to be talking with you today about some of the experiences we've had within the state in sharing our experience with the PIP process. So Maryland, many of you may know, is a state-administered jurisdiction that oftentimes likes to pretend we're county administered. And so what that means is that our counties have quite a bit of autonomy and individual opportunities to nuance practice. What that poses sometimes is a challenge in regards to consistency in practice and the application of policies. And so with our CFSR process recently, we've been able to pull our local partners together in some unique ways to be able to build in some consistency across our state. So we also, as Maryland, were a part of the 4E waiver and have been building some stakeholder engagement with many of our, what we call sister agencies across the state. So Department of Health, Department of Education, Juvenile Services, and really also engaging with our provider community and our service providers in some new and different ways and bringing them to the table with us to engage in conversations and get a sense of how we're doing. And we were able to really build on this through our state-led CFSR that was 12 months ago now. We found in our findings with our CFSR that there were some areas that weren't really surprising in how we were doing based on the conversations we'd been having with our stakeholder partners. And so we were able to actually engage recently in a new pilot for the program improvement plan process that allowed us to bring a large number of stakeholders together to really sit down and talk about what our CFSR results said and begin to integrate that feedback into our planning and strategies identification. One of the things that we were all consistently raising in our conversations across 5 days was that we wanted to find new and better ways to build authentic partnerships across entities, meaning across all the different systems that serve children in the state of Maryland. And so that required some rolling up of our sleeves and having some really transparent, honest conversations about what does that actually look like. And so we had an opportunity to sit down with our court officials. We sat down with many attorneys. We are line workers, our frontline workers, the ones that really know how practice is playing out in the field and what some of those challenges are. And we had leadership from across our local departments, as well as having some of our other key stakeholders. So providers and service providers, but also I think really the essential piece was the fact that we had parents who had lived experience, as well as young people who had experience and what it actually was to receive what we were doing across the state, and really hold us accountable to what we thought we were doing, and being able to add a flavor of what their experience in our system really was. And so over the 3 days, we identified the authentic partnerships across entities and then created some strategies that are going to build in some of our kind of ongoing activities in a way that carry us across systems for our striving for improvement across Maryland. And so we are planning town halls across the state that are going to have kind of a subset of all the folks that were at the table with us to talk about what are our issues, how are we doing, and then creating a toolkit for folks at the local level to actually be able to continue to have those conversations and create some of those individual localized strategies that might be really nuanced depending on where you are and what your role is. And with that, it has created an ability to have some conversations that maybe we weren't always comfortable having, because it's hard to talk about findings and data and outcomes if they aren't really good, because you're always day-to-day working on trying to do the best you can, and so it's hard to have a transparent conversation. But I think by building the relationships that we've been doing over time and then bringing people to the table during our PIP development process, we've been able to evolve into a relationship where we can have those transparent and honest conversations even when it isn't a good picture, and be able to then jointly think about strategies and ideas about how we move forward for the ultimate goal that we all have is improving the lives of children and families across our state.
so excited that you're here with us this morning. My name is Amanda Cruz, and I have had the opportunity and the joy to be a family consultant for the Center for States for the last 5 years. I also serve as the president for the Florida Foster and Adopted Parent Association, and this is my first year in that role. It's been a really exciting year watching some of the changes of the way that family consultants and family voice has been shaping child welfare. And when I say family voice, I want to be clear that I'm not just talking about foster parents, although that's who I directly represent. I'm also talking about birth parent voice, although family voice is much better in how we should represent that word. Birth parent has a stigma, foster youth has a stigma, so family voice encompassing all of the different consumers of the child welfare system. And it has really changed what we know makes an effective program. And it is exciting to watch as different players and different groups from the child welfare system reach out, engage, laws change both federally and at state levels, and programs are starting to trickle down and really have that direct impact with authentic voice. And we want to make sure that that is something that we continue not just to strive to, but that we know and we're following. One of the things that hit me as I was listening to everybody else's introductions is they have a lot of data, right? And they know a lot of things, and they know about CQI, and they know about the PIP and the CFSR, and I've been at the table for all of those things. But I don't have a degree in all of those things. And that has been okay, and more people who don't have necessarily the data background are being asked to the table to say, what does this really mean for you? How is this really implemented? And what is the point behind these numbers? How is that translating to the child after reunification? That's great that the statistics are looking great, but is the child happy? Is a child who is adopted actually thriving and succeeding in life post-adoption? Are they having open relationships? Is that going well in a more qualitative fashion? And I think that that is such an exciting time in child welfare and really changing where we're going. That pendulum swing to more open and more relationships has been such a magical gift over the last 5-ish years. I really think that the trickle-down effect when we have ineffective programs is something to look at. When we are not allowing authentic voice, real relationship, or people to do their basic jobs, we see the outcome of the numbers, and we see programs not being as effective, people not being able to supervise visits, families not reunifying quicker. And every time I see those numbers, when there's really ineffective numbers and people talking about why isn't this happening, you see children not going home, you see longer stays in foster care, less reunification, longer stays before adoption. And it's really that voice behind those numbers of why. What are we doing differently? How can we utilize some of our key ground players of foster parents, parents, children, to make sure that we change these numbers around? I think that one of the things that Rebecca said that they're doing in Maryland was so exciting, right? Getting families engaged all in the same room, all at the same time, and those programs are happening across the nation. We have exciting, effective programs. Gainesville, Florida has a community program that has a very specific community focus where they have families come in and it serves as a prevention arm of the whole child welfare system with funding and partnership throughout the whole community, and has changed the data tremendously in that area. We also have visitation centers creating positive interactions between birth parents, foster parents, and the children in Washoe County. And it is changing their data and pushing children to go home quicker with healthier relationships. We have birth parent programs where there are peer advocates working who have successfully navigated the system in Seattle. All of these programs are changing the needle of child welfare. It's really important that we are working at the transaction and relationship level. And that is really what I am here to talk about, and just excited that you're here with us. Thank you.
Hi, I'm Dr. Brenda Dion Madrigal, and I'm here to talk about evidence from an American Indian perspective. So I'm going to answer this question, what is evidence, through a story. A story through the eyes of a Turtle Mountain Chippewa urban American Indian who married into the Cahuilla tribe of Southern California, and who also happens to be a psychologist and has worked in Indian country for over 20 years. So in 2011, a very dear friend of mine, was in danger of losing everything he'd ever worked for, and the thing that he cherished most. This terrified him. There was nothing he could do about it. So in response to the pain that he was feeling, his body literally started to shut down. He couldn't eat. When he would try, he would feel like he was gagging and like his insides were closing in on him. So a few of us in his close circle were concerned, and I called a colleague of mine and friend, Betsy, up in Oregon, who happened to be living with a Nez Perce elder and spiritual leader. And she told him about my friend's situation. And he said, we need to do a ceremony tonight. So they started gathering the firewood and the necessary supplies. Now the problem is that he was up in Oregon and we were down in Southern California. So when it was time to light the fires, Betsy called me on the cell phone and I put it on speaker. We were all crammed into a truck in the parking lot of a Sizzler, about as unceremonial as you can get. I don't remember how long the ceremony lasted. I just remember the singing, and when it stopped, my friend could eat again. He could eat again. So we might say that this is the power that had come, or as my husband would say, we know it. From an Indigenous perspective, this is evidence. From an Indigenous perspective, this is evidence. Now this is coming from someone who understands evidence-based practices. I spent over a decade culturally tailoring evidence-based family strengthening programs for American Indian communities with my colleague Dr. Betsy Davis at the Oregon Research Institute and my husband Luke. I started out at the Oregon Social Learning Center under the partial supervision of Dr. Jerry Patterson, a pioneer in parent-child interventions and multi-method measurements using direct observation, the gold star of evidence-based practices. Do we agree with what evidence means? No. So a lot of evidence-based programs, for the most part, aren't even evidence-based for American Indians. American Indians weren't the population that they were designed for or tested on. So what's a main consideration to think about in applying evidence-based practice for American Indian communities? And so I'm gonna say to you the same thing that was said to me by an Indigenous elder when I was starting out as a young psychologist, and that was do no harm. Art Blue, an Indigenous Canadian elder, said this to me at a Society of Indian Psychologists conference in Utah in the late 90s. Do no harm. So I'm going to talk today about a harm of assimilation. So I was working on a National Institute of Drug Abuse randomized controlled clinical trial in Indian country with my colleague Betsy. And it was Betsy who went to Roy, the Nez Perce elder, and said, why aren't we reducing health disparities in Indian country? And his answer was, you have to go back to the beginning. So I go back to the beginning, actually, to the tribes of Europe and what happened there that led to what ended up happening over here. So for the purposes of this talk, I'm going to go back to Scotland and the disposition of land as reflected in a popular English nursery rhyme at the time. And in the rhyme, the word common refers to the collective ownership of land. The law condemns the woman or man that steals the goose from off the common, but leaves the greater felon loose that steals the common from the goose. Now this taking of land from the people went along with the taking of knowledge, because at that time universities started springing up in Europe, Oxford for example, and knowledge became something that was inside the walls of those universities as opposed to the outside. So I have a couple papers in the references that talk about decolonizing research and story science, and I'm going to read a few quotes that highlight some of the points that are made in those papers. Research in Aboriginal communities has been a method of colonization due to the illusion that science is neutral and objective. Many of the studies conducted in Aboriginal Native communities represent replicas of Western paradigms that are imposed on Native communities and thus perpetuate hegemony disguised as an attempt to help.
Evidence-based practices refer mostly to university knowledge systems, which in nearly every part of the world are derivations of the Western canon. The knowledge systems created some 500 to 550 years ago in Europe by white male scientists. The epistemologies of most peoples in the world, whether indigenous or excluded, on the basis of race, gender, or sexuality, are missing. But evidence of other epistemologies and other ways of representing knowledge exist. And what is generally understood as knowledge in the universities of our world represent a very small proportion of the global treasury of knowledge. Evidence-based practices can be seen as a form of further assimilation, particularly the assumption that Western forms of knowledge are superior to broader, more indigenous ways of knowing. American Indians had no voice in the construction or interpretation of how Western science laid out the parameters of how evidence was to be defined, gathered, interpreted, or applied, leaving them with no voice in the foundation or frame that was set for the social interpretation of knowledge. And they had no vote in the decision to privilege that way of knowledge as the gold star of evidence. In other words, we don't see ourselves in the Western-based evidence story. And this is really no different than what led my daughter, a 16-year-old Native actress, to see that she wasn't seeing herself in the stories being told in the theater or the movies. In fact, she wasn't seeing her stories being told at all. And so this led her to look back into the old stories and gather 3 Cahuilla stories that informed her decision to write a play about missing and murdered Indigenous women and girls that's being performed in our communities today by non-acting community members as a healing ceremony. My daughter's telling her own story in her own voice from her own cultural foundation helped her to see that the taking of Indigenous girls and women is really part of a larger taking of our stories, our culture, our voices, our knowledge. So this leads me to another term, hermeneutical injustice. Miranda Fricker, it's another paper that I've included in the references. Miranda Fricker defines hermeneutical injustice as occurring when there is a deficit in our shared tools of social interpretation, such that marginalized social groups are at a disadvantage in making sense of their distinctive and important experiences. Within American Indian communities, historical trauma could be seen as an example of this. So American Indians came up with the term historical trauma to talk about the suffering that we were seeing in our communities. And Maria Yellowhorse Braveheart defines historical trauma as a constellation of characteristics associated with massive cumulative trauma across generations. For so long, we were told that there's no proof of historical trauma, and we didn't need Western science to tell us that it was real. But recently, Western science in the field of epigenetics has discovered that in fact there is a spirit of trauma that seems to be passed down a family line. What happened to our ancestors impacts us today, whether we know what happened or not. So now historical trauma is considered real because it's been validated within a Western paradigm. But how long did that take? I'm not saying that we can't use direct observational random assignment. In fact, we did use direct observational methods as one way of finding evidence. I'm just saying if we are going to use those methods, those studies and that evidence really needs to be gathered by American Indian people from the point of conceptualization to the methods that are chosen, to the way that the interventions led, to the interpretation of the data, to what's defined as a good outcome. And so what is a good outcome? So really not that long ago, a good outcome was a picture of Indian children in uniforms with their hair cut. Indian children that had been put in boarding schools. That was a good outcome. Children that went through those boarding schools, their descendants today are having outcomes that we don't consider are good outcomes, or having difficult outcomes that are directly related to risk factors in child welfare settings. So what is a good outcome? Well, let me just say there's a lot of focus groups done in Indian communities and a lot of listening sessions. I first started doing focus groups in the 90s, and I recently did some in 2019 with American Indian groups. And what I heard then is no different than what I hear now, is no different than what is in reports, the California Reducing Health Disparities Report, Native Vision, and that is American Indian communities should be supported in efforts to revive or sustain cultural traditions, practices, language, and ceremonies to address the loss of culture and improve wellness. So can we do evidence-based practices in Indian country? Yes, but it needs to be led by Indian people. And what are good outcomes? Good outcomes are things that sustain and revive our traditional cultural beliefs and practices. And let me just end with the words of an indigenous African man who spent 25 years in Western universities, working in Western governments, and taking Western practices back to Africa. And what he concluded after 25 years, he went back to his elders, and this is what he said: "We will never realize our full potential as people in our communities and as contributors to the global treasury of knowledge if we continue to depend wholly on the content and ways and knowledge of European peoples. Our way forward must be linked to the recovery, replenishment, and revitalization of our thousands of years old indigenous knowledge." Thank you.
My name is Alicia Summers. I'm the Director of Research and Evaluation for the Capacity Building Center for Courts. In this role, I do a lot of work with the child welfare court systems and court improvement programs, specifically around helping them to understand data, research, evaluation, and what we mean by evidence. And the evidence piece is critical for us because it's such a hard question when you're talking with the courts for them to understand. What does that mean and how do we apply it? If we're thinking about evidence, we often think about how we use that to make decisions. So let's think about that in terms of how we make decisions in our everyday life. Let's say you're traveling to a new place. And when you get there, the first thing on your mind, at least if you're me, is what am I having for dinner? So you have to think about, how do you know what to eat, where to go, where to find this information? And there's a couple places you could look for information. You might have a colleague or a friend that lives in the area that can give you a recommendation, and it might be a very enthusiastic, I ate at this place last night and it's amazing and you have to go there, or it might just be a list of potential places. You could also consider looking for an expert in the field. Maybe your hotel concierge who has a list of available restaurants and some recommendations. And a lot of people use Yelp. So it's an application on your phone. You can scroll through and look for things nearby, and that has the added benefit of having customer reviews and on a rating scale, so you can see how many stars the restaurant gets. And you can do specialty searches. I only want vegetarian options, or I really want pizza tonight. So it's customized to meet your needs. So that's one way that we would gather in evidence and information. But when we're talking about the child welfare system, it's infinitely more complex. And the stakes are so much higher, because now we're not talking about what I want for dinner, we're talking about the lives of children and families involved in the system. And that's a harder thing to think about. Because of that, we also have to think about, these are not people that know necessarily who to ask for information, how to ask for information about evidence, even what questions that need to be asked. For dinner, we know what we want. It's an easy question. For evidence, it's a much harder question. Part of the problem is evidence doesn't have one easy definition. What evidence has is a continuum and range of definitions across multiple fields. And most of them agree it's not one definition, there's evidence or there's no evidence. What it really is a continuum. And on one end of the continuum, we know nothing. We have no evidence, we have no idea if something works, there's just nothing out there. And on the opposite spectrum, we have what we consider our gold star as a researcher, which is an evidence-based practice. This is when there's been very rigorous research where we've randomly assigned people to a group and let them see if it worked in a way. So did the intervention group look different than the control group in terms of outcomes? And the reason this is the gold star is because this is the only way we know if the evidence shows a causal link between our intervention and our outcome. Everything else is just a relationship. And this entire continuum is based on the rigor of those studies. So the no evidence, then you have a little evidence, maybe some data, some trends, some anecdotes that say this is effective. Then you move up. There might be a study, an evaluation, something helpful, some information, some comparison, but it doesn't quite meet that high criteria. It doesn't quite meet that gold standard. And the reality is, in the courts, we rarely meet that gold standard. To get to an evidence-based practice requires a lot of resources, a lot of time, and a high level of control that we just don't often get to do in the field. What we most often see in the field are what I would consider more modest but meaningful evaluation studies that make some sort of comparison, that look at some data that a state or court or county has used to really look at, is my program working for me? Is this enough information for me to say, I want to keep doing this, or I want to expand this to somewhere else? That's typically what we see in this field. So if you're thinking about, as a policymaker, a decision maker, people that need to make important decisions about what do we do to improve outcomes for children and families, how do you know where your program might fit? I've just said there's a continuum. How do you know? You have a program, where is it going to fit in there? It's not an easy thing to know. As a researcher, it's a little easier for me, but not everybody goes to school forever to study data, research, and evaluation. And there are ways to be a really good, informed consumer of information. So if you want to know where your program fits in, think about it in terms of what you can know so that you can review the information in a meaningful way. The first thing you should know always is, what does your data say at your state or your county? Because that's going to be really important in asking the right questions later on. So asking what you know. What does your population look like? What's the population with the highest need? What are the outcomes that you really need to focus on to improve for children and families? Those are things that you should know coming into any conversations around evidence. You can also know what the continuum of evidence looks like. The Center for Disease Control has a great guide on a continuum of evidence of effectiveness that spells it out in a really user-friendly way. It explains what we mean by rigor and different study designs. It's a great resource to learn more about a continuum of evidence. It's also important to know where to go for information. There are clearinghouses out there that rank things on evidence for you. You don't have to do any of the legwork. The California Clearinghouse for Evidence-Based Practice, crimesolutions.gov, both of those have resources that rank programs. So someone submits a study, they evaluate it and give it a score. You could go on and see where they score it on the continuum of evidence. So there's information there. You can also look for people who compile information in a meaningful way. So the Child Welfare Gateway, they compile information. What do we know about adoption? What do we know about reunification? What do we know about visitation? Compiles all that research to a user-friendly way so you can start looking into what we know, what evidence is already out there. You can also, when you're thinking about this, think about it in terms of, okay, I have a couple resources, I have some places to go. What are going to be my next challenges? And you're probably going to have one of two. The first is, you're going to have way too much information. Let's say as a court you've decided you want to implement a mediation program. So you start looking and see what the research says. You get a bunch of academic studies, some reports, there's websites that talk about this. You have all this information on mediation. How do you know if you're going to implement, or you should implement this in your site? There are three things that you should ask if you're thinking about this. The first is, who did this work for? Look at the population in the studies. This is an important factor. If you know that in your state the biggest need is getting teenagers to permanency, and all these studies focus on infants and toddlers, that's not evidence that this is effective for you. So think about your population, how it relates to the study population. The second thing to think about is the outcomes. Do the outcomes match the outcomes you need? If you know your biggest challenge is timely adoption, and all the studies focused on timely reunification, that's not evidence that this is going to be effective for you. So think about how your outcomes match up, and if they do, and if they don't, are they similar enough that you could try this? And then the third question is, how rigorous are the studies? We often see in the courts a lot of descriptive information, someone talking about a program, just describing it. This is what we did, this is what our numbers look like. But if they're not comparing it to anything else, it's going to be lower on that continuum of evidence. So think about, is there a comparison group? Did they use a random sample or random assignment? And just learning some of those key phrases can help you think through what that could potentially look like. The other problem you might have is too little information. So you have decided we're doing this intervention, or we have this outcome we're fixing. What do we do now? And you want to figure out, is there evidence at all related to what I'm looking for? I think it's important to go down the list and think this through. So start at the top. You know that there's a clearinghouse that lists out evidence-based practices. Look at it and see if your program's on there. See if there's programs that relate to your outcomes on there. So start there and see if there's the information that you need. If it's not there, start looking at the websites that compile information together in our field. See if they have some information that can be useful, a resource to you, somewhere to start, if there's anything out there that demonstrates any type of evidence on that continuum. You can also make connections to researchers at your local universities or technical assistance providers in the field. We have access to academic journals. We have access to the courts that are doing this work that may not publish the reports, might be able to give you some more information about what we know and what evidence is out there to help you. You should also consider this an opportunity to talk, get the voice of your participants. If you want to know what works for timely reunification, talk to the families that were successful at this in your courts. Ask what worked for them. Dig into that as a piece of additional information. And then a final consideration is think about the positive deviance in your own state. So if you look at every county in your state and you have one or two that are doing great at timely permanency, ask what they're doing. Find out if they've implemented something, if there's something there. So what's that evidence look like? And again, it's going to be a little lower on the scale than it is higher on the scale, but it will get you there. Most often in the field, what I see is we get people, leaders in the field, go out to conferences and they meet a very charismatic speaker who's very excited about the program or practice that they've implemented. And they come back home and they say, we're doing this. And they miss all those other critical steps. They don't know what the data says. They don't know what the research says. They haven't asked those three important questions. Who was the study designed for? What were the outcomes of interest? And how rigorous of a study was this? And that's a big step that we typically miss in the courts, is skipping the asking about the evidence and better understanding whether the evidence really applies to the issue at hand. And that's definitely ways that the courts can be more informed consumers in the field.
As we close our first conversation today about effectiveness in child welfare, a few key themes emerged. There are cross-cutting opportunities for the unique systems in child welfare to work together to be more effective and improve outcomes for children, youth, and families. The foundation of these partnerships is built on a shared understanding of the data that each unique actor holds and promoting the value of data and effectiveness for all layers within an organization. It starts with the engagement and integration of youth and family voice in child welfare work, the frontline service professionals who work hand in hand with families, the supervisors and administrators who coach and model effectiveness, administrators in leadership that guide the vision for effective practices, and federal partners who support effectiveness through assessment and program improvement planning tools that provide a foundation for measuring effectiveness. And finally, awareness that a critical piece of being effective is in the work that we do to improve outcomes in relationships, building relationships with families to support reunification, relationships with system partners to work more collaboratively and intentionally together to create a shared vision, and building relationships with community partners to ensure that all families have the resources and supports that they need to thrive.